An expert from the UP National Institutes of Health dissected the efficacies of various COVID-19 vaccines in a House briefing. According to Dr. Edsel Salvana, shots developed by Moderna and AstraZeneca are effective in preventing severe infection. The same type of efficacy was found on Sinovac's vaccine after clinical trials were conducted in Brazil. Recall that the Chinese shot has drawn doubts among Filipinos after it was reported to have only 50% efficacy rate. But Salvana clarified that such figure only refers to Sinovac's ability to control symptoms from developing. Under this criterion, the vaccine of Pfizer turned out to be the most effective with 95% efficacy rate. That's why for Salvana, the government needs to consider not just one or two vaccines for deployment.
Pinaka-importante po talaga na ma-deploy natin yung mga vaccines that can prevent severe disease. At ang bakuna na nakaka-prevent ng severe disease ay makakapababa sa panganib ng pagkamatay sa ating vulnerable population.
Once the inoculation happens, the physician urged people to still observe minimum health standards. Salvana explained that the efficacy of the vaccines in preventing virus transmission is yet to be proven. Meanwhile, Health Secretary Francisco Duque III said a house-to-house vaccination is being planned. According to Duque, this could be done among members of the vulnerable population such as senior citizens.
Pero this is more exception rather than the rule. Kasi po, kailangan din natin talagang bantayan yung post-immunization surveillance, monitoring, and recording of adverse events.
As for the timeline, vaccine czar Carlito Galvez Jr. reiterated that inoculations may begin first quarter of the year. One of the shots expected to arrive first are the free COVAX vaccines for 22 million Filipinos. The government also targets to purchase 148 million doses to immunize up to 70 million people this year. Galvez added that talks with various manufacturers, including Moderna, are ongoing. To speed up the process, the vaccine czar said a centralized procurement will be the best approach. But Marinduque Governor Presbitero Velasco, president of the League of Provinces, has an appeal to the national government.
Only concern is the authority of the local governments from the national government to procure directly vaccines from the suppliers.
Malacanang earlier said LGUs cannot procure their own vaccines unless they enter into a tripartite agreement. For News 5, Ria Fernandez, We Are One News.